So nobody wants to be alarmist here, but we do need to be realistic, especially when the Quebec College of Physicians has now come forward to recommend wearing masks again in public because child respiratory infections are surging. And then, of course, there's the flu and COVID. I mean, the word that no one wants to hear ever again, but it is still hanging around. In the midst of all of this, how are things going in schools? Let's find out. Olivier Drouin is the founder of COVID Écoles, and he joins us again now. Hi, Olivier.
Hello.
Thanks so much for your time. I think it's been about a month since we last spoke, and I remember being unpleasantly surprised, I would say, about the situation in schools. I don't blame you at all, and you know, they don't shoot the messenger. I appreciate the information, but it was not a good situation. How are things now, Olivier?
As you know, the government doesn't declare the absenteeism anymore for school. What we've had through media requests was that there was about 3,000 students that were absent for COVID reasons and over 95,000 for other non-COVID related reasons.
How many? Sorry, what was that second? What was the second figure?
95,000 absent children in school for non-COVID related other reasons.
Okay.
So those are very large numbers, of course. And so what's also worrisome is that the removal of the 5-day isolation is making the students that are present also problematic because it's not because there's students in class that could be symptomatic without a mask and COVID potentially contaminating their counterparts or their other friends in class.
And teachers, right? I understand that
Correct.
Teachers are now allowed to go to school even if they're testing positive as long as they are wearing a mask and don't have a fever.
Correct. That's what changed in the last month is that the 5-day isolation rule going away, which means everybody, adults and children in both daycare and school can go back as long as there's no fever for 24 hours. Well, the problem is the 60 to 70% of transmission of COVID is asymptomatic. And compound on top of that, the other respiratory viruses. And like you said, COVID is like the word that nobody wants to pronounce, like Voldemort in Harry Potter. Mm-hmm. Because I have testimonials from schools, letters that they sent to the parents, and the word COVID disappeared all of a sudden. It's now they're referencing a group of respiratory viruses impacting children.
Okay, well, obviously there are a group of respiratory infections, but there's no data being released on any of it, as you mentioned. So we don't know what is COVID, we don't know what is RSV, we don't know what is the flu or a cold. There's no information whatsoever, right?
That's correct, but not all viruses are made the same, and COVID is known to create also in a certain percentage of the kids or adults long COVID, the collateral damage for many different months, if not years. So it's not the same as having a flu or RSV for children. So they are all grouped right now, but they don't have the same impact and effect. And we're back to not looking at the root cause of the problem. So there's the debate right now. As you said, the mask is being softly recommended or strongly dependent on the verbiage. But at the end of the day, the root cause is air quality. And air quality is not good in class or daycares, and actually could prevent transmission even further and reduce the bottleneck right now in the pediatric emergency rooms.
Do you feel like, I'm about to ask you a question that I've asked you so many times, Olivier. It's like deja vu because we seem to be stuck in the same place and constantly having to, ask the same things, which without having any progress made. So I'm going to ask the question, already kind of knowing what the answer is. Where are we in terms of air quality in classrooms and having the CO2 detectors and the air filtration systems updated?
We're at the same place where we're debating on masks instead of asking the government, what have you done about air quality? So the answer is nothing, and we haven't seen any progress. We have a new Minister of Education, Mr. Drainville. We have high hopes that he will tackle the problem, but since his nomination, we have not seen anything to the subject other than a public declaration that 95% of classes were okay, which was not factually accurate. And we have many readings from the CO2 detectors proving otherwise.
We're speaking with Olivier Drouin, who's the creator of COVID Écoles. I highly recommend following him on Twitter if you want to have a good picture of what is going on in Quebec schools right now. So as we mentioned, recommendations are being made, but kind of softly, Olivier, and the latest being Quebec's College of Physicians saying, okay, children need to be masking up again. I'm going to ask a question that I know the answer to, but do you think this goes far enough? Would you like mandates to come back?
What I've seen today, the INSPQ, the Research Institute
yes.
Of Health in Quebec, they actually do surveys. And we saw that in the last survey, people think the most effective measure to prevent COVID is washing your hands. So I think there's a communication, education problem. So, of course, no, I don't think it's going far enough. I think there's lots of education on aerosol transmission of COVID that needs to be done. And there's lots of education on mask wearing for sure. So they may not mandate it, but at least having a very strong recommendation and educating on the transmission, the aerosol transmission, which is not the same transmission as other respiratory viruses. So it looks like they've grouped all of these viruses together because they cannot tell based on the symptoms which one it is, and they've kind of given up on testing, the testing strategy.
Yeah.
Which we should go back to some of the basic elements that don't cost a lot of money. Isolation doesn't cost anything. Mask doesn't cost anything. Acting on the air quality, same thing with the low-hanging fruit, for example, Corsi horizontal boxes that could improve the air in classes.
I know that we were both hoping that things would be different under Bernard Dranville than they were with Jean-François Roberge. And as you said, so far it's very much not looking that way. First of all, how are you getting the information right now? Are you doing an access to information to get any?
Yes, I did actually.
Yeah, okay.
I've made several requests on air quality, on the absenteeism. I'm getting also all of the communication that parents are getting through COVID Écoles Twitter account and social media. So I'm still getting a lot of information on what's going on.
Okay. And then give me a picture of how we're doing right now. And again, I know it's kind of piecemeal. You're having to put this together yourself with all these different bits of information. But compared to a year ago right now, how are we doing, Olivier?
Well, a year ago, we were before the big Omicron wave, so we were getting about 30% of the cases that were declared were related to less than 18 years old for kids. Mm-hmm. So today, the INSPQ on their website, they actually estimate that we have over 23,000 to 31,000 cases per day of COVID, believe it or not.
Holy moly.
And about probably 7,000 to 9,000 of those are children. So that's a lot of cases which we didn't see, and of course we saw when Omicron started in January. So we're not blind to the information. The information does exist out there on the Quebec government website, but it's not publicly made available every day.
Last week, Olivier, we talked about a poll that had been done by Léger for CTV News that said that Canadians on the whole were really quite receptive to mask mandates being brought. They said 7 in 10 were receptive or somewhat receptive. In Quebec, it was 65%, which was one of the lowest provinces. It was the second lowest province, but still surprisingly high. The theory being that people say they're on board, but then if it was actually mandated. However, given these numbers, what do you think the hesitation is here? Why are we not having mandates? Why are people scared to do something that's going to keep us safe?
I think there's in Quebec. I hate to use the language card, but yesterday, just give you an anecdote. I was at the Seagull Center to watch a great play.
Oh, did you see Dracula?
Yes, I did.
Isn't it great? Yeah, it's wonderful, isn't it?
Yeah, we loved it. We loved James Daly. Anyway, so the story was that they were distributing masks, and I had also the pleasure to go see French theater, and you see the culture is different. I mean, there was masks everywhere at the Seagull, and at the Saint Denis, maybe a week or two prior to that, we were the only ones with masks. So there's something in the population that the government communications kind of normalize COVID, and it's okay to catch it, and reinfections, and it's not that bad or that big of a deal. That kind of normalized catching COVID, which is very, very sad because catching COVID, there's nothing normal about it if you look at all the science behind it.
Well, it's a crapshoot. It might be totally normal. It might be like absolutely near nothing for you, but it also might kill you or land you in a hospital. Was that your dog?
Yeah, it was.
Your dog's getting in on it too. Wear a mask, the dog's saying. Olivier, it's always so great to catch up with you. Did we cover everything? Is there anything else you feel like you want to say before I let you go?
Yeah, no, I think we've covered everything.
Okay, you go scratch that dog's belly, okay?
Yeah,
okay. Have a great day. Thank you for your time.
Thank you.
That is Olivier Drouin, again, creator of COVID Écoles. Highly recommend following him on Twitter.